Thank you all for tuning in to our virtual presentation. We're so happy to be part of this multidisciplinary symposium for APA this year. The title of our presentation is Elevating Low-Income and First-Generation Health Service Psychology Graduate Student Voices. We are Adriana Crossing, Stephanie Campbell, Truong, and Dr. Celeste Malone.
In this presentation, we'll provide an overview of the need for the study, relevant background research, the methodology, anticipated results, as well as future directions. So why the need for the study? Health service psychology is an overwhelmingly homogeneous field that does not reflect the racial, ethnic, linguistic, and socioeconomic diversity of the populations that we serve. A diverse health service psychology benefits us in two ways. First, psychologists in training are able to enhance their cultural awareness through having experiences and exposure to experiences other than their own. Secondly, society benefits because diverse viewpoints and perspectives will improve our research and practice related to culturally responsive mental health services. Given the benefits of a diverse workforce, we need to consider who has access to doctoral education and identify and dismantle the financial, structural, and cultural barriers which have excluded many groups, such as those who are racial ethnic minoritized individuals, individuals who experience low-income economic marginalization, or LIEM, and those who are first generation to higher education. When we consider issues of access, cost is certainly a significant factor. Next slide, please. But when we think about costs, we need to think about it in the broadest sense. So not just tuition, but there's also the opportunity cost due to loss of potential income while in graduate school. There are also several hidden fees with regards to being in doctoral education, such as program and university resources, having to purchase textbooks, university fees, and those who are first generation may not know how to navigate those structures and how they could increase their access to the resources that they need. There's also a high cost to be involved in the profession, including professional association membership dues, the cost of travel to professional conferences, as well as internship interviews. As a result, though we see much higher attrition for those who are first generation and those who experience economic marginalization, but especially those who hold multiple marginalized status. So looking at the intersection of ethnic racial minoritization and LIEM and first generation status, and Du will provide some more information about that.
Hi, yes. And so we talk about like Latinx and Black individuals are systematically affected by poverty. Based on the data from the U.S. Census Bureau in 2016, they show that they are 2.5 times more likely to live in poverty than white individuals. It is also worthy to know that 66% of doctoral student loans are from the field of psychology overall, and psychology doctoral students, both in PhD and PsyD programs, have much higher cumulative means than other doctoral students in other fields. So first generation and graduate students face additional stressors, including not being savvy with knowing the hidden rules in navigating graduate programs, which can result in them taking more years in their programs and may lead to like accruing more student debt. Graduate programs for health service psychology is cost prohibitive for LIEM students. From a 2019 study by Wilcox and colleagues, they show that health service psychology graduate students and early career psychologists with lower socioeconomic status report higher financial distress, greater impact on their personal and professional lives, and nevertheless, there is very limited research specifically about the students with intersecting identities of LIEM and first generations in graduate training of the field of health service psychology. Students with intersecting minoritized identities of being racially ethnic minoritized, LIEM, and first generation are very much more likely to drop out. This can be due to the limited sense of belonging from both their home and graduate programs, as well as experience of isolation, marginalizations, and microaggressions. And just as Dr. Malone talked about earlier, it's important to increase not only recruitment, but also retention for graduate students with intersecting minority identities due to the large mismatch, as you can see in the graph here, between the health service psychologists in the workforce and the populations we actually serve in our countries. So based on the 2015 APA survey of psychology health service providers, while the whole US population, which is 62% white and 38% racial ethnic minorities, the workforce has actually 88% white compared to only 12% racial ethnic minorities. So therefore, research is needed to guide policies to close the gap between those demographics between the practitioners in the workforce and the population we actually serve. So now I'm going to pass it on to Adriana.
Thank you so much, Ju. So I wanted to spend some time before we dive into the methods, emphasizing the importance of 2020 as a context for this work. This year has shown us that there is a significant need for equity. And we've known this for years, but the COVID-19 pandemic demonstrated so many more gaps in resources than I think a lot of us were considering. And even though we're all under a considerable amount of stress due to COVID-19, we know that students that have these multiple minoritized identities are experiencing even higher degrees of stress due to various barriers. And that leads them to having more stress and more to cope with during their graduate training. Before I move on to discussing our methodology, I did want to let you all know that this is a study proposal because our study was delayed due to the COVID-19 pandemic, but we're still very excited to begin our data collection this fall. So in this next section, we're going to discuss the methods that will include design, theory, participants, recruitment, anticipated data collection, and anticipated analysis. So first, this is a qualitative study proposal. We are using interview methods, and we're looking forward to that. School psychology is very quantitative, so we're excited to branch out of it. The language of our interview protocol was very carefully chosen to minimize reproducing oppressive norms. Also, this is a qualitative study with an emergent data plan, and so no a priori hypotheses have been proposed. We want the data and the participants to speak for themselves as the experts on their own experiences. The presenters here have also done considerable work on our personal identities and discussing those to make sure that our pre-existing knowledge does not influence our data collection and analysis and following dissemination. I also wanted to spend some time talking about the foundational theories and approaches of our work. So first, we're using phenomenological variant of ecological systems theory from Margaret Beale because it includes consideration of social and historical and cultural systems that influence the person at the center of that system. And it also talks about the strength and resiliency of that individual. We're also using intersectionality, so consideration of the way multiple identities intersect with systems of oppression. This term was coined by critical race theorist and legal scholar Dr. Kimberly Crenshaw, but exists at the end of a very long line of Black feminist thought. Lastly, we'll be using critical inquiry approaches. We've been using it for study development, and we'll be using it for data collection and analysis. And this includes interdisciplinary approaches, self-critique, privileging all knowledge, and the awakening of a critical consciousness. All right, Steph.
All right, so as Adriana mentioned, this project is underway but not yet started. Our IRB is approved with exempt status, and so soon we'll be recruiting participants, which will all be health service psychology doctoral students from all three branches, counseling, clinical, and school, from 3 different universities. And these students will need to identify as low income at any stage of life and or be first generation college students. To do this, we will be contacting program directors and program chairs via email. So for data collection, we will be conducting our interviews on a HIPAA compliant video conferencing. We'll be using Zoom for this, keeping only the audio recordings and then destroying those recordings as soon as transcriptions are made. For our interview, we will have a screening process first, and then we'll be asking about experiences relating to inhabiting those LIEM or first generation identities, as well as the barriers and supports that they've faced or experienced in their doctoral programs. So we ask these questions so that we can figure out some specific strengths that the students hold and the ways they have been resilient amidst the difficult, inequitable ecologies inherent in our capitalist nation. And all of these questions are for the purpose of gaining some rich personal narratives to help identify some future steps to promote equity for these and other students. For data analysis, as Adriana was mentioning, dismantling oppressive structures and moving intentionally toward liberation is a core function of the broad category of critical theory. And so taking it not just with the theory, but critical inquiry and critical qualitative methods, we'll be using consensual qualitative approach so that we're reducing the person's power, one person's assumption by doing it with consensus, and then trying out some existing qualitative critical methods, including Carr-Specken's meaning field analysis. And to look at the data, we'll be utilizing in vivo software. So why are we doing this, and what do we hope to inform? So this is not only to understand and better the experience of an individual or just one student, but also to build and sustain more equitable training for health service psychologists for years to come. So we hope by having the narrative, individual voices of students who have lived these experiences, especially within this chaotic time in America, we hope that we can help give suggestions so that accrediting bodies, graduate programs, internships, all those who are serving these students can both serve them better and then also help them serve future clients better. For example, there are areas of recruitment, retention, and accreditation that can all be adjusted or considered to better serve graduate students from LIEM or first generation backgrounds. We think programs should be accountable, and it shouldn't be on the backs of just one ambitious and caring faculty member, but making sure that this is something that is programmatic and global to best support these students.
All right, thank you, Stephanie, so much for wrapping up our presentation. That is our study proposal. Here are our references. This font is itty bitty, so please check out our uploaded slides if you'd like to more deeply engage with the literature on which we based our study. Here's our contact information. Our emails are in the top row there underneath our photos, and then our Twitter handles are just underneath that. Again, we are Adriana Crossing, Stephanie Campbell, Truong, and Dr. Celeste Malone. We look forward to engaging with you all on Twitter on Tuesday, August 18th from 5 to 7:30 p.m. Eastern Time. Again, thank you so much for engaging with our scholarship today and the interdisciplinary panel of which we are part. Thank you, and have a good day.